Hello everyone, welcome into the ITLS Academy. Hope you are safe in this quarantine period. I'm Dr. Himani, and now we just start our first lecture on the communicable disease and public health. So, the first thing is just we are discussing about the introduction of communicable disease. Vaccination and control of communicable diseases are two of the great public health achievements of the last century. Infectious diseases are now the world's biggest killer of children and young adults. Both are vital age groups. About 32% of all deaths worldwide are caused by communicable disease, maternal and parental conditions, and nutritional deficiency. They account of more than 13 million deaths a year, one into two deaths in developing countries. Almost 90% of these deaths are caused by pneumonia, tuberculosis, diarrhea disease, malaria, and HIV. It is a fundamental part of whole of epidemiology. So now next thing is, what is health actually? Health is a combination of physical, mental, emotional, and social well-being. Physical health equal to the condition of your body. Mental health and emotional health, your thoughts and feeling combination. And social health is like the way you relate the other people. So now, what is public health? Action by society to protect and promote the health of the everyone. We can say this is called the public health. It's required knowledge, skill, motivation, and commitments. It involves science, evidence, art, politics, and imagination. Requires leadership and cooperation also. Requires partnership and the involvement of the population. Now, what is the concept of public health? The science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts for the sanitization of environment, the control of community infection, the education of the individual in the principle of personal hygiene, the organization of medical and nursing service for early detection and prevention treatment of disease, the science and art of preventing disease, promoting health, and prolonging life through organized efforts of society. The dimension of public health. Now we are discussing about the dimension of the public health. So here is the four pillar of public health. First is the preventing medicine. Second is social medicine. Third is community medicine, and last one is community health. Now first we are discussing about the preventing medicine. Prevention is better than cure is one of the prime messages of public health. It differentiates public health from the clinical disciplines that are primarily involved with the care of the sick, whilst public health emphasizes the avoidance of the illness. Now, social medicine. The poor die young. The rise of social medicine consists with increasing realization of the link between social status and the health of individual and communities. Now we are discussing about the community health. Yes, community health deals with the services that aim at protecting the health of the community. The interventions vary from environmental sanitizations, including vector control, to personal health care, immunization, health education. Now, what is the community medicine? That specialty which deal with populations and compromise those doctors who try to measure the need of population both sick and well, who plan and administrate service to meet those needs, and those who are engaged in research and teaching in the field. So now, primary prevention of communicable diseases. Community actions involved in these things. So many points we can cover in these community actions, like colonization of the water supply, inspections of the restaurants, immunization program that reach all citizens, maintenance of a well-functioning sewer system, proper disposal of solid waste, control of vectors. Personal and individual action also involved in this. In this primary prevention, we can include hand washing, proper cooking of food, adequate cloth and housing, use of condoms, obtaining all the available immunization against specific disease. Now, secondary prevention of communicable disease. In this sector, community effects efforts is like include measures taken or to control or limit the extent of a disease outbreak, investigating cases and contact those who may have become infected through contact with case. Occasionally, secondary disease control measures may include isolation or quarantine. Further measurements may include disinfections and mass treatment with antibiotics. Maintaining records of cases and compliance with regulations requiring the report of the notifiable diseases. Individuals force also come in this secondary phase. It could be included like self-diagnosis and self-treatment with non-prescription medicines or home remedies. Diagnosis and treatment with an antibiotic or other physician or prescribed medicines. Now we are going to discuss about the tertiary prevention of communicable disease. In this, physical therapy we can include it. In some cases such as paralytic polio, return to normal activity may not be possible even with extensive physical therapy. At the community level, proper removal of infection items such as a clothing, disinfection and burial of the dead. Now, herd immunity for the prevention. Here we can discuss about the herd immunity because Here, immunity is the main pillar for preventing of communicable disease. Like when a high percentage of the population is vaccinated, it is difficult for infectious disease to spread because there are not many people who can be infected. We can understand by example here. Suppose if someone with suffering with coronavirus is surrounded by the people who are vaccinated against corona, the disease cannot easily be passed on the anyone and it will quickly disappear again. This is called herd immunity or herd protection, and it gives protection to vulnerable pupils such as newborn babies, elder pupils, and those who are too sick to be vaccinated. So you can also understand by these photographs of herd immunity. So now rainbow of health determinants, economic, environment, and social equities can determine pupil risk of getting ill, their ability to prevent sickness, or their access to effective treatment. Now, just we can understand like this the rainbow of health determinants is divided in different parts. Like we can start as age, sex, and hereditary factors. Second pillar is individual lifestyle factors. Third pillar of this rainbow is social and community network. Fourth pillar is living and working condition. In this pillar, so many points can be included like agriculture and food production, education, work environment, unemployment, water and sanitation, healthcare service and housing. These all things are included in the living and working condition. And last, general socio-economic, culture and environmental condition play a crucial role in this rainbow of health determination. Disease and its type. So now, what is disease? Any disorder or malfunctioning of the body or mind that destroy good health can be called as a disease. A disease can be caused due to a variety of reasons. Every disease has characteristic symptoms through which we can identify the types of disease. Now, types of diseases. We can differentiate or we can be divided into two parts, communicable disease or non-communicable disease. Communicable disease is like these are infectious disease capable of passing from one person to another person. Non-communicable disease are those diseases which are not infectious, which may result from genetics or lifestyle. Communicable disease. Now we are going to understand what is the communicable disease. Disease that are spread from one person to the other. Disease that are caused by germ or pathogen. Pathogen can enter the body through direct or indirect contact causing illness like influenza. It is a biological agent that causes disease or illness. to its host. Pathogen and vector, we can understand what is the pathogen. Pathogen are disease causing agent. Bad germs is the example of pathogen. And now vector. Vector are disease causing organisms that carry pathogens from one host to another. We can understand pathogen and vectors by the example like mosquito transmit malaria and ticks transmit Lyme disease. These are the examples of the pathogen and vectors. So now types of pathogens. There are different types of pathogens: bacteria, virus, fungi, and protogens. So we can understand is a basic concept. What is a bacteria? Bacteria is a single celled organism. And what is the viruses? Viruses are genetic material surrounded by a pathogen coat. Example of the viruses is HIV, cold, influenza. In these days we are suffering from coronavirus is also an example of virus. And fungi can be multicellular or single celled, like so many types of fungal infection, like at least food is also example of fungi. Protozoans are single celled organisms like a malaria. So different types of pathogen and disease, we can see here the list of bacterial disease, parasitic disease, viral disease, influenza, fungal disease. It could be, this chart can be a brief knowledge about the different types of diseases of bacterial, parasitic, and viral, influenza, and fungal disease to understand. Now, mode of the transmission. Mode of the transmission, breaking the chain at the mode of transmission is one of the most important way to interrupt the spread of infection. This is where infection prevention and control strategy can be most successful. Microorganisms are transmitted in healthcare setting by four main routes: contact, droplets, airborne, common vehicle. So now first we are going for discussing about the mode of transmission is like contact. Contact is most frequent mode of transmission of health care associated infection and can be divided into direct and indirect. Direct involves direct body surface to body surface contact and physical transfer of microorganisms between an infected or colonized person to another person by touch. Indirect involve contact between a person and a contaminated objects. This is often a result of unclean hand contaminating an objects or environment. The microorganisms remain on the surface to be picked up by the next person who touched it. Mode of transmission is droplets. Transmission occurs when droplets contain microorganisms generated during coughing, sneezing, and talking are propelled through the air. These microorganisms are relatively large and travel only short distance, up to 6 feet or 2 meters. However, these infected droplets may linger on the surface for long period of time. So these surface within the range of the coughing, sneezing person will need additional cleaning. So now other mode of transmission is airborne. Microorganisms carried in the manner remain suspended in the air for long period of time and can be dispersed widely by air currents. Because of this, there is a risk that all the air in a room may be contaminated. Some example of microorganisms that are transmitted by the airborne route are tuberculosis, rubeola, and the hantaviruses. Airborne transmission of infectious agent occur either by airborne droplets nuclei. It could be small particles of 5 mm or smaller in size. Dust particle containing infectious agents. Mode of transmission is common vehicle. Applied to microorganisms that are transmitted by contaminated items such as food, water, medications, medical devices, and equipment. To inhibit the transmission of microorganisms by this mode, we can follow some tips like a clean patient equipment between uses with different patients, handle stores and prepare food properly, careful stores and draw up dose of medication from multi-dose medication vial. Types of communicable disease depending upon sources. It like it could be divided into four parts like respiratory infections, intestinal infection, arthroborne infection, surface infection, sexually transmitted disease. And respiratory infection, maybe tuberculosis is the example of respiratory infection. Hepatitis is the example of intestinal infection. Borne infection disease, uh, plague could be the example of borne infectious disease, and leprosy, example of the surface infection, and AIDS is the example of a sexual transmitted disease. Now, periods of disease. Here, infectious typically have 5 stages. Now, we are going to understand these 5 stages. First is incubation period. This stage starts from the moment when the pathogen enters the body to the appearance of the first system. Now, prodromal stage, non-specific system appear first, like fever, tiredness, and general discomfort usually last just a few days. Now, third stage is illness. This is when more specific symptoms appear. The number of pathogens is at its peak here. The main manifestations and length will depend on the patient and the disease. Now, other phase is decline. In the decline period, patient may become susceptible to developing secondary infectious because their immune system have been weakened by the primary infection. Last stage is convalescence. This is symptoms disappear. The symptoms disappear in this phase and the immune system return to the normal. So now next is prevention the spread of a communicable disease. In this phase we can add so many things like wash your hand often. This is especially important before and after preparing food, before eating and after using the toilet. Now, second thing is get vaccinated. Immunizations can drastically reduce your chances of contracting many diseases. Keep your recommendation vaccines up to date. Third is use antibiotics sensibly. Take antibiotics only when prescribed, unless otherwise directed or unless you are allergic to them. Take all prescribed dose of your antibiotics even if you being to feel better before you have complete the medication. Next is the stay at home if you have signs and symptoms of an infection. Don't go to work or class if you are vomiting, have diarrhea, or are running a fever. Be smart about food preparation. Keep counters and other kitchen surface clean when preparing meals. In addition, pro- perpetually refrigerator leftovers. Don't let cooked foods remain at room temperature for an extended period of time. Practice safer sex. Use condom. Get tested for sexually transmitted disease and have your partner get tested or abstain altogether. Don't share personal items. Use your own toothbrush, comb, or razor blade. Avoid sharing drinking glasses or dining utensils. Travel wisely. Don't fly when you are ill. With so many people confined to such a small area, you may infect other passengers in the plane, train, bus. Talk to your doctor about any special immunizations you may need. So now we are going to discuss about how are infected disease treated. If bacteria cause a disease, treatment with antibiotics usually kill the bacteria and end the infection. Viral infections are usually treated with supportive therapies like rest and increased fluid intake. Drugs have been developed to treat some but not all viruses. Topical antifungal medication can be used to treat skin or nail infection caused by fungi. Some fungal infections, such as those affected the lungs or the mucous membrane, can be treated with an oral antifungal. Most serve internal organ fungal infection, especially in people with weak immune system, may require intravenous antifungal medications. Now, diagnosis. How we can diagnose different types of communicable disease? We can diagnose by the laboratory test. In this phase, your doctor may order lab work or imaging scans to help determine what causing your symptoms. Laboratory test maybe in this field A sample of body fluid can sometimes reveal evidence of the particular microbes that causing the illness. Blood tests also play a very good role for testing the communicable disease, like a technician obtain a sample of blood by inserting a needle into a vein, usually in the arm. Urine tests also play a very good role for determining the communicable disease. This painless test require you to urinate into a container to avoid potential communi- contamination of the sample. You may be instructed to clean your genital area with an antiseptic pad and to collect the urine midstream. Now, throat swab. Throat swab uh, is also a very important step for detecting the communicable disease, like sample from the throat or other moist area of the body may be obtained with a sterile swab. Stool sample also play important role. You may be instructed to collect a stool sample so a lab can check the sample for parasites and other organisms. Biopsy. During a biopsy, a tiny sample of tissue is taken from an internal organ for testing. For example, a biopsy of lung tissue can be checked for a variety of fungi and can cause a type of pneumonia. Thank you for listening me.